Hello and welcome to our Intermountain Healthcare News Conference today. Just a quick reminder to mute yourself and put any questions you have in the chat function of Zoom, and we will also be answering a few questions in Spanish at the conclusion of the English portion of this news conference. We'll also be sending out an email right after this news conference with links to pictures and new ICU B-roll video. For CG and titling purposes of all of our presenters, check your email reminder that was sent out this morning, and all the participants' names and titles are listed there. We'll begin with Dr. Katie Thomas, our Associate Medical Director for Intermountain Medical Center. Dr. Thomas.
Good morning. So we're here today to share what we are doing currently to help manage the growing COVID population. In March, Intermountain created an organized system via which we could take care of our COVID population but continue to manage our patients who don't have COVID but also need health care. That plan has been implemented and edited numerous times over the last weeks and months. In the last week, we've had to use part of that plan that we hoped we would never have to use. We're happy that we have the plan in place, but it would be ideal not to have to go there. There's a team of over 70 leaders from throughout the system who are part of this team that continues to organize and implement this plan. That group monitors progression of COVID-19 patients and volumes throughout the system and throughout the state on a daily basis. We have an agile process that uses real-time reporting and numerous huddles throughout the day to help coordinate an effort that enables us to take care of these patients in the right places. The goal is to match the needs of the patients and the families with, most importantly, the providers, but also with the PPE that they need, the facilities that are appropriate for them, and other supplies that are necessary. The goal of this allocation and reallocation is to continue providing the highest level care for every single patient that we see. And staffing remains something that we are constantly working on. In light of this, we have asked our caregivers for months now to challenge their flexibility, their level of fatigue, and their commitment to us and to our communities by working extra shifts and overtime. And we are incredibly grateful that our staff have continued to rise to that challenge and shown their dedication to our communities. We're also grateful for the collaboration that we have with our community, and particularly grateful for the individuals and the families that have made sacrifices now for months in order to prevent additional spread of this virus. Thank you, everyone, for doing that. There are limits, as we know, to what our current staff can handle, and there are limits to what our current configuration of beds can take care of. So, in light of that, we have reallocated beds in different facilities in order to take care of patients. Our ED team throughout the system has been phenomenal in identifying patients who can be best treated in or equally treated in other facilities. And they work with our hospitalists, our intensivists, our tele-hospitalists, and our tele-intensivists to coordinate transfers from one facility to another if necessary and appropriate. Individual hospitals have changed the way that they take care of patients and changed their capacity. With regards to the Salt Lake Valley in particular, IMED has changed some non-ICU beds into ICU beds. Tosh is now taking care of medical patients. Riverton has opened up its pediatric floor to adult patients. Altaview is opening up additional beds in a couple of weeks. Primary Children's Hospital is taking care of adult patients in the ICU, and they are phenomenal at doing that. And then LDS Hospital has made some significant efforts to continue to help take care of this population. And I'll let Hallie speak to that in a few minutes. As one of my colleagues says, Beds don't take care of patients, people do. And staffing has been a challenge, like I said before. As an ICU physician, I can confidently say that nurses are essential to the phenomenal care that we provide to patients. They are the heart of the hospital, and they're the heart of our ICUs. As volume exceeds our capacity to take care of patients, we need more nurses to help our nurses out. We've hired 190 travelers to help our facilities take care of patients, and we are so excited that they have started to come. And we have 31 nurses here from New York, which we are incredibly grateful for. Those nurses have graciously and enthusiastically enabled us to continue providing that high-level care to patients. Equally importantly, these nurses have provided support to our current staff so that they can continue doing what they're doing and better take care of themselves and their families. So I'll have you talk with the New York nurses in a few minutes, but first I'm going to hand it over to Hallie Rector, who's the nurse administrator at LDS Hospital, who's been a phenomenal partner in these efforts.
All right, thank you, Dr. Thomas. So as you've all have heard, we know that our admissions are increasing significantly, and much more so just the last few days. You've heard about the collaboration that we have between our facilities, especially within the Salt Lake Valley. We are balancing the patients and sending them to the different facilities where we have the beds and the staff to best take care of them. This is also happening across our system. Our largest facilities like St. George, Utah Valley Hospital, Intermountain Medical Center, LDS Hospital, and McKay are taking the most critical of those patients. But all our facilities are taking COVID patients as well as caring for patients with other healthcare needs. As specifically at LDS Hospital, we have taken our 16-bed ICU and converted all of those ICU rooms to negative pressure rooms. This allows us to be more safe in how we're caring for our COVID patients and protecting our patients as well as our caregivers. Additionally, we have 10 ICU beds in another department that we have opened up, or we're ready to open up, and actually this morning are going ahead and opening due to the increased cases that we're seeing in our facilities and the need for those ICU beds. I do want you to know that we have incredibly highly skilled caregivers, both physicians, nurses, our techs, our respiratory therapists, pharmacists. It is taking all of these different staff members and caregivers to help us care for these patients. So we are ready and ready to take care of all of them. Our teams, though, what I really, want to share is how hard our teams are working. This is incredibly, incredibly hard work. Watch these caregivers on a daily basis, be with a patient we're working with end-of-life issues, and maybe family is positive with COVID and is not allowed to come into the facility. So we're having to communicate with that family via technology. These are things that we've never had to do before, and it's incredibly hard. Or it's taking the time to hold the hand of the patient that was just placed on a ventilator due to COVID, and they're just so scared. But those nurses and those caregivers are standing by those beds, holding those hands, and communicating with those families, and just helping us get through these processes. They are working short-staffed. They are working many extra shifts, and they are tired. So I think with that, my plea to all of you is to please do what we know is working. Wear your masks, wash your hands, social distance. We are heading into our holiday seasons, and we all want to be with our family and with our friends. But at this point in time, we just need to really think about how this is impacting everyone, and just take the moment to do the right thing and protect our caregivers, protect your family, so that these caregivers can be here to take care of your families when they're needed. Again, I want to really thank our New York nurses. They have been phenomenal. They are incredibly skilled caregivers, but also their enthusiasm and just energy has really uplifted the spirits of our teams during this difficult time. So their timing of when they have arrived here could not have been better. And they are working at both Intermountain Medical Center as well as LDS Hospital. And I think with that, I'd like to turn it over to Natalie Torrance. She is the team lead for the New York Presbyterian hospital nurses that are here visiting. Thank you.
Thanks, Holly. I'm honored to represent our team of 31 nurses from New York Presbyterian. And I'd like to take this opportunity to thank the Intermountain staff and their nurses here who have been so welcoming and such incredible hosts for our team. In April in New York, there were days of absolute exhaustion and stress of our staff throughout the whole hospital. And I remember the night some of the Intermountain nurses initially walked in. It was such a sense of relief for myself to know that we had just a few extra set of hands to help care for our patients in that moment. Now it's our turn to come and help return the favor here. The NYP nurses on this trip each volunteered to come for 2 weeks, leaving their families and friends home in New York City. I wish all 30 nurses could be here today to help share their stories of why they volunteered to come, but I would like to share a few of their stories myself. One nurse stated, "I wanted to help return the favor, ease the stress, and give the nurses here a sense of support as they came and did the exact same for us." Another team member hoped that sharing our knowledge and our skills and our experiences of caring for these COVID patients would help give them a huge sense of relief, seeing that we had their backs and that they will make it through this. An ICU nurse shares, "There were so many patients and not enough of us to take care of all of them." The Intermountain nurses jumped in immediately to help us, and I recall thinking, they are fearless and so selfless, not really knowing what was ahead or what to expect. Our nurses can relate to the stress and fear of an impending COVID surge. The support and encouragement we received not only from the Intermountain healthcare team, but from nurses all over the country was absolutely inspiring. I will say the difficulties of the COVID pandemic, there are certain silver linings. It's led to new partnerships and have created a bigger healthcare community nationwide. The collaboration between the New York Presbyterian and Intermountain healthcare system, I will believe, will be a partnership continued outside of this COVID experience. Just as our nurses have supported each other this year, and the nurses and the medical professionals have supported your community for many years, we need your help. The support of your community here is absolutely vital. Please wear your mask, please continue to wash your hands frequently, and please social distance. This is how we will be successful in preventing the spread. Thank you to Intermountain so much for helping to help build these relationships for many years to come. I'd like to introduce one of our emergency department nurses, Wenzhao, to share her story. Thank you.
Good morning, Utah. My name is Wen. I'm a nurse in the ER at New York Presbyterian Brooklyn Methodist Hospital. And I decided to come to Utah because I wanted to pay it forward to the frontline workers who left their homes to aid us at our time of need. It was really vital and essential to us, and we are so thankful. It was a sense of solidarity from around the country that was heard nationally that inspired me to continue to do my job, because a sense of solidarity a battle is easier won together, and it is the circle of trust and support that has kept us going. I'm so proud to be a nurse, and I'm so grateful to have this partnership with Intermountain that gave me a new perspective, gave me a new refreshed sense of passion for my job, because I see it here. We are all working for our community here together. It has been a wonderful experience. So thank you very much for allowing me to come help you guys.
Thank you so much. We'll now open it up to questions. Please put your questions in the chat, and if it's not obvious, tell us who you are and who you're directing your question to. First off, we have a question from Jed Bowl from KSL. He wants to know, what are the most important things New York nurses have learned about COVID that will help them here? Natalie, do you think you could answer that question?
Absolutely. So I would say behind the scenes, there's been a lot of communication and collaboration between our two hospital systems. From a medical standpoint, we've been able to share a lot of things that we felt like what really worked for us, as well as things that also really didn't work for us. So behind the scenes, I know this has been an intricate part of Intermountain healthcare system in creating their surge planning. Outside of that, I also think it's been really important for us to share the mental health and well-being of our own healthcare professionals. And we've been able to have a lot of discussions and suggestions of what we really help to find resilience in our New York healthcare professionals and how we can help create that here as well.
Okay, question from Jared for Wen, wanting to know exactly what it's like working in the ICUs. Wen.
Hi, Jared. I'm actually a nurse in the ER, but I can still speak on caring for COVID patients. This is a whole new experience for everybody. They're scared, they're anxious, and they don't really understand what's going on. So you just try your best to, explain to them what's happening, and you just care for them like any other medical patient. It's a new experience for everyone. But I was really scared too, because we've never seen anything like this, to this acuity, to this capacity. But here we are working together, making it through.
All right, we have another question from Aaron. Natalie, I think this would be good for you. Have the New York nurses started taking shifts yet? If so, what are the differences you've noticed between the situation here and what you experienced in New York in April?
Absolutely. Yes, our team of 31 nurses, we arrived last Wednesday, had orientation on Thursday, and our nurses started shifts right away last Friday. So we've been here working on the floors with the Intermountain staff for about a week here. I'm sorry, can you repeat the second part of the question?
Just compared to what you saw in March, what's the comparison?
Yeah, so I think it's been really, really wonderful that we've been able to share our experiences in New York before we hit this point in time. Intermountain Healthcare has been absolutely wonderful in being very organized with their surge planning and helping to prepare for a moment that none of us really wanted to ever see, but Intermountain Healthcare has done a wonderful job with their surge planning and with their plans to open up new critical care beds based on what we had previously experienced in New York.
Thank you, Natalie. From Wendy Leonard, Desert News. She wants to know what the plan is for the future after these 2 weeks are up and the surge in cases is ongoing. Dr. Thomas.
So the plan continues to evolve, and there are really two things that we're looking at as we move forward. One is physical space, and so we are being creative with regards to where our patients can go and where they can be best served. There are beds, and we can get patients to those beds. With regards to staffing, this is one of the issues that we're solving right now with travel nurses and with nurses from New York. We're also staffing up from a nursing perspective. So the goal is to continue ramping up our staff in order to continue to care for the patients that we need to.
Why don't you just stay up there for a question from Aaron again. How many of Intermountain hospitals have open overflow ICU capacity?
I don't know the specific number. Intermountain Medical Center has.
Great. And again, what can you say about how close its hospitals are to capacity, reached it, exceeded capacity?
Capacity is tricky because it's physical space and staff. And so right now we are taking care of all of our patients. We're just doing it in a creative way.
Any other final questions? And then we will answer a few questions in Spanish for our Spanish-speaking media. Aaron asks, are you concerned that ramping up nursing staff will become less feasible as the virus gains ground in other states? Dr. Thomas, or do you want to answer that? Go for it.
That's a great question, and yes, I think we are concerned. But as Dr. Thomas, alluded to, we have figured out creative ways to do this. We are working on what we call a dyad model at times, where we're using an ICU nurse and a med-surg nurse together to care for some ICU patients. That allows us to take care of a few more patients than normally an ICU nurse could do on her own. Our leaders are, freshening up on their skills and are ready to step in and help as well. Our nursing leaders. So I think, we will do this, and our teams are stepping up and, like I said, working extra so that we can make sure that we're caring for all our patients. So we have plans. It's not going to be ideal, but we will take care of the patients.
Thank you. And then one final question that Dr. Thomas will address. How in particular are things in northern Utah? McCady Hospital, same issues as the rest of the state, more acute in Salt Lake City area with bigger population question, issues in terms of patient overload, et cetera.
We are seeing the same phenomenon throughout the state, and hospitals are responding in a similar way throughout the state. Everyone is having to do things differently than we have in the past. So it's not significantly different.
And what about southern Utah?
Same. Everyone's seeing volumes and has been challenged with regards to staffing and has found creative ways to put patients in the right spaces.
And so finally, can you address also why it's so important for the community to help us to reduce these cases? Why do we need the community to help us?
If the community doesn't, there's a big chunk of the community that's been doing everything they can. And without that part of the population, I don't know where we would be right now. And so I want to continue to be appreciative for everyone who has done that and continues to do that. If the population who is not masking and distancing does not start doing that, I'm very fearful as to where we're going to be in a couple of months. It's essential that we all be respectful of our community and the health of our community.